Hi, I'm Dr. Matt. This is Dr. Brandi, and we're two of the chiropractors here at Miller Health and Movement Physiotherapy. Today we want to talk about low back pain and some of the exercises that you can do to give yourself some relief. So obviously with back pain it can be quite painful, and if you've given yourself a couple of days rest, the best thing you can do for yourself is start moving and start doing some exercises that are going to help you. So the first exercise we want to do is an overhead reach, so I'll demo it. What you want to do, this is a spine sparing strategy where you shouldn't feel any pain in your back and this should feel good. You want to elongate your spine, reach towards the ceiling as far as you can, and then I want to reach up higher with one arm and then alternate and reach up higher with the other arm. Again, this should feel pretty good, and I want to feel like I'm really pulling my ribs off my iliac crest here and through my pelvis, so I want to feel a nice stretch when I'm doing this. Okay, and you can do this 10 times a side, hold it if it feels really good, alternate to the other side, just like that. Okay? Next exercises I'll demo on Dr. Brandi, so I'm going to get her onto the table. And so this is usually for those exercises that are a little bit extension intolerant, so if you come back you have a lot of pain when you go into extension. So we're going to get her to come down into an exercise called the prayer stretch, or the child's pose. So again, her butt is down onto her heels. She has a nice rounding in through her low back, and she should feel a nice stretch, or you know, that kind of good pain feeling when you're in a stretch like that. You can do a variation, reach over to one side, stretch in through the lat and through the QL on this side here, go over into the other side, walk out. Again, you should feel a nice stretch in through there as well. If one side feels better than another, you can hold that side a little bit longer. You can hold these for up to 30 seconds, back off, and then re-engage the stretch for a total of 1 minute to 2 minutes. Next exercise, I'm going to get Brandi to hop onto her back here. So we're going to put one leg flat, and we're going to grab the other knee, and we're going to pull it up into her chest. So this is called a single knee to chest here. Again, this should be relieving in through the low back. Okay, and she's going to hold that. Alternate, bring it up into the other side there, hold it. You're going to hold it for 5, 6 seconds, 10 seconds. If you want to add a variation to that, you can take this knee to the opposite shoulder, and that'll engage the glute med there and get a nice modified stretch to that hip. Okay, next exercise that we're going to do is a lower rotation. So we're going to have her knees up. She's going to be flat on her back's flat on the table, and then she's going to drop her knees gently to the one side. Again, this should be a nice stretch in through the low back. You can hold that 10 seconds, 5 to 10 seconds, bring it over, do the other side. To make it a little bit more challenging, if you need a better stretch, you can pull your shoulder, your opposite shoulder down to the floor on the other side, and that should increase the stretch that you feel. Again, do this 5 times a side. Next exercise that we're going to do is a posterior pelvic tilt. So for here, again, flat on the floor, there's going to be that rounding into the low back. Dr. Brandi is going to put her hand underneath. And then what she's going to want to do is she's going to want to tilt her pelvis and press her back into the floor. Okay, again, this should give you some relief. She's going to hold it for about 5 or 6 seconds, and then she's going to back off, and she's going to do that 5 or 6 times. Excellent. So again, not all exercises work for all people, so these should be relieving. So if you have any increase in pain on any of them, what we want you to do is you can call us, book in if you want to review any of these, or if you have any pain going down your legs, that's something that you should get checked out by your healthcare provider. But feel free to check us out online at millerhealth.ca.